Maybe burnout isn't about overwork at all. We're told it is. Work too many hours and you burn out. So the solution sounds simple. Cut back on your sessions, take more leave, protect your weekends. But if burnout were just about hours worked, why do so many doctors who now work 3 or 4 days a week still feel flat, cynical and emotionally drained? I see it in GP colleagues, I see it just as clearly in hospital doctors. The problem isn't just tiredness. Burnout goes much deeper than fatigue. It's about identity. And no amount of annual leave will fix that. Hi, I'm Dr. Finbar McGrady. I burned out as a GP 15 years ago, but I recovered and I discovered real joy in medicine again. On this channel, I share mindset tools and real stories to help doctors grow, respond, and stay well without losing themselves in the process. Most of us didn't go into medicine to become box tickers. We trained to become doctors, people with judgment, autonomy, and real relationships with patients. But somewhere along the way, the system shifted. And whether you work in general practice or in hospital medicine, you're increasingly treated not as a clinician, but as a provider. Targets, templates, coding, throughput, high patient turnover, always being measured and rarely given enough time to do the job properly. When I was working in full-time as a GP, I remember many clinical days when a patient's computer record would flash up alerts, overdue smoking status checks, or prompts to ask diabetic patients about erectile dysfunction, all while the person sitting in front of me had come in because they were either overwhelmed or anxious or depressed or something else. That created a gap between what the patient needed in that moment and what the system expected me to do. I had trained to be a kind and caring doctor, someone who met the patients where they were and helped them at their point of need. Yet, I found myself being distracted and sometimes forced to ask questions that were irrelevant in the moment, driven by more targets and external agendas than clinical judgment. That tension creates something called moral injury. And moral injury is not the same thing as burnout. Burnout suggests that you are the problem, that you are not resilient enough, you're just not coping well enough. However, moral injury recognizes something different, that your values are being violated quietly and repeatedly day after day. And when this goes on long enough, we adapt, we detach, we become cynical, we emotionally numb ourselves. Not because we don't care, but because caring hurts when there's no space to do it properly. And this is where the real fracture happens. You start asking questions you never expected to ask yourself. Is this it? Is this medicine now? Who am I in it? For me, it showed up as frustration. The feeling of working with my hands tied behind my back. Pressure to ask questions unrelated to the patient's concern just to get the box ticked. Measured as quality care while knowing we were measuring the wrong things for the wrong reasons. And this is why even after time off or reducing your clinical sessions, that hollow feeling comes straight back when you return to work, because rest alone doesn't repair your identity. So what can we do without walking away from medicine altogether? Well, we can start by reclaiming agency. Now that means separating your job, which exists inside a flawed system, let me accept that, and separate that from your identity, which must never be fully owned by the system. And there's a simple place to start. You ask yourself this honestly. If the title doctor disappeared tomorrow, who would I still be? What would you do? Who are you? The doctors who stay well long term aren't just the ones with the lighter rotas. They're the ones whose identity isn't entirely consumed by medicine. Now, this isn't about pretending that the system is fine. And it's not about leaving a profession you once loved. It's about recognizing this. If your entire sense of self is owned by a system that repeatedly violates your values, something in you will eventually fracture. Reclaiming agency doesn't fix everything, but it gives you back something essential. A sense that you still exist inside the work. And sometimes that's the difference between surviving medicine and quietly disappearing inside it. If any of this feels familiar to you, please give the video a like. It helps it reach other doctors who may be wrestling with the same questions. And if you'd like to explore this further, I've linked another video below, The Truth About Dr. Burnout. Hope to see you in the next one.